doing today?
All right.
Pretty good.
Thanks.
Okay, so have you ever been to therapy before?
I've been in couples therapy.
Couples therapy?
Yeah.
Okay. Well, just so you know, anything that you say here stays here. But if you tell me that you're going to harm yourself or harm others, I do need to take care of that. But other than that, you can tell me whatever you feel comfortable telling me. So what brings you in today?
Got in a car accident not too long ago. Since then, I've been in pain, chronic, this constant pain. The pills the doctor put me on doesn't really help too much. It's more nerve damage. So it's just, it makes me irritable, makes me angry,
Sure.
stressed out.
Yeah. So how, what was the car accident like? Was that also traumatizing or?
It was pretty bad.
Okay.
My whole leg got busted up. I had to go through rehab. I had to learn how to walk again.
Wow,
So
that's tough.
yeah, it was a pretty bad accident. It was on 295.
Okay, New Jersey.
Yeah.
Yeah. So how long was that healing process?
About 6 months.
6 months?
Yeah.
Wow, and when did this happen?
Last year.
Last year.
Yeah.
So you're 6 months after right now?
Yeah. It happened about a year ago.
Okay.
Last summertime.
So do you think that the pain is what brings you into dealing with your pain, or kind of?
I don't know. I have nightmares sometimes too. I don't like getting in the car. When my wife drives, I just get anxious. Constantly worrying about getting in other car accidents.
I'm sure. And when you're not in control, that's also can be challenging.
Yeah.
So what are your nightmares like?
It's just about not even really about car accidents most of the time. Just about getting hurt. There's fire in some of them. They're very vivid, but I can't remember all of them.
Okay.
So it's ends up right before you get hurt. I don't know if you ever woken up right before you get hurt.
When you're about to fall and then you
Yeah,
wake up.
you're about to fall, about to get I don't know, whatever, but
Okay. So you said that it's mostly nerve pain now?
that's what the doctor says.
That's
yeah.
what the doctor said. So are you doing anything now? Any physical therapy or?
No, I mean they put me on medicine,
Mhm.
just some pain meds to take when needed, but it doesn't really help too much since it's nerve damage.
Okay. Are you taking them or you just don't take them?
I'll take them when it gets really bad, when it starts interfering with work.
Mm.
Otherwise, it just.
So how has your pain been interfering with work?
Some days I can't. It hurts to sit down. It hurts to just kind of do anything. So.
So it varies day by day?
Yeah, it varies day by day. Some days I can't concentrate. Some days it hurts too much to even really move out of bed.
Okay. That's really difficult.
Yeah.
So what have you been doing to kind of cope with that otherwise?
Do stretches.
Just doing stretches.
We started going back to the gym. Can't really do too much though, just because you don't want to push it too much.
Right.
And the lower back still hurts, so I don't really do too much. I'm mainly just walk on the treadmill, do some walks here and there. But
are you able to walk on the treadmill?
yeah, as long as I don't go too fast.
Okay.
It's a little bit easier for my knee.
Well, that's good.
Since it's a little less pressure than walking outside, but
Yeah.
I don't really do too much.
Is there anything else? Do you enjoy walking outside, or you prefer
I like walking
on the
outside, but
treadmill?
I can't really go too fast. I don't like walking on the sidewalk or near the streets too. So.
Okay. I'm sorry. What do you do for work?
I am actually a psychologist.
Oh wow. Yeah. Okay. So counselor, getting some counseling. That's always good.
Yeah.
So do you think that your car accident has affected your performance with counseling, or?
Yeah. Because like I said, in session, I can't even sit down sometimes.
That takes you out of it.
Yeah, and if I can't listen, I can't focus in.
Yeah.
It's hard to focus sometimes. especially when I'm doing like administration work, all those kind of things, since I
Okay.
own my own practice, so.
Wow, that's awesome. Good for you.
Thanks.
So it takes you out of the administration work. Do you think it takes you out when you're face to face with them?
Yeah, oh, for sure.
Yeah. So do you think
When
that's
it's bad.
when it's bad? So do you think that's been? Do you think your clients have noticed, or
I don't know.
way to know?
No one ever said anything, I don't know.
yeah,
Probably, but.
maybe. So how do you think your wife has been?
She's been a big support. We went to couples therapy before
Okay.
the car accident, but since then she's been a big support, helping me out through
Mhm.
rehab and stuff, and just getting me things when I can't like walk around too much.
That sounds like you have a nice support system.
Yeah, she's supportive, but it doesn't really feel like, it kind of feels like sympathy sometimes,
Okay.
so.
You think that she's doing it because she feels badly for you, or how do you feel?
I feel like if I was better, I don't know if she would still be with me or not. I don't know if like the car accident, like, yeah, I don't know, like, I don't know if I'm like a sick puppy that she's kind of like repairing and like healing, like is needing to take care of me or something like that. I don't know.
Wow. Do you have like an example of anything that makes you feel that way?
She's always like asking if I like need something, like physically done, but like we don't really spend any like quality time or like intimacy. So
So what would that look like for you?
we like we'll just kind of like sit around. She'll be like on her phone,
Okay.
or just like lay in bed and she'll be like watching TV or on her phone. or
Just
something.
not really.
Not really
quality
there.
Time.
Yeah, we don't go out really anymore. Like I said, I don't like getting in
Yeah.
the car that much.
Mhm.
So
I'm sure it's hard for you, and you went to couples therapy
yeah, we went before the accident.
before the accident.
Yeah, we only went a few sessions though.
How did it go?
I guess we didn't really get too much into it.
Were you going and then the accident happened?
We stopped maybe like a month before the accident happened,
Okay.
just because it was bi-weekly, so it wasn't like
Mm-hmm.
we had too many sessions in there.
Right.
Yeah.
So do you think that helped with anything at all?
But which one? The accident or the counseling?
The counseling, not the accident.
I don't know, man. I feel like it didn't really help too much.
Mm-hmm.
I mean, the person was respected in the field, but it just, I guess we didn't really go to enough.
Mm-hmm.
So,
Would you be interested in trying a different counselor?
couples therapy?
Yes.
Not right now.
Too much. You gotta focus on you right now.
Yeah, just deal with kind of like everything that's been going on.
So do you think that, I'm sorry, do you have kids? I'm not sure.
Mm-mm.
No kids?
Okay.
Well, that's good. You don't have any little ones to take care of right now. Do you think that your accident is kind of holding your marriage together right now?
In a way. Like I said, I don't know if she just feels bad, like who's gonna leave, like, you know, an injured dude. That would be kind of like a shitty thing to do.
Mm.
So I don't know if that's what's going through her mind. Kind of feels like that sometimes. So I can go hang out with her friends a lot, or like go out with her like family.
Without you?
Yeah, because I'm not gonna go anywhere too
Mhm.
much. No, that's fine, but it feels like she's with them more than me. And then when she's with me, it's just kind of like, if you need anything, I'll get you this, that,
Yeah.
you know, those kind of things.
Or maybe planning some things at home that make you two come back together? Would you be interested in that?
I don't know, like what?
I mean, you could always do like your own arts and crafts night. You know how they have like the painting with the twist? You
Yeah.
could try to do that at home, even though you would have to go out to buy the supplies, but you wouldn't have to be out for too long.
Yeah.
Are you driving, or is she driving you everywhere?
She'll drive me for the most part, and she stay at home.
Okay.
So, but I'll drive. My office is close by, so it's not very far. But anything long,
Still triggering.
I get anxious in the car.
Mhm.
And I'm constantly worrying about like what other people are doing. I drive slow.
Okay.
Thankfully, it's only like 5-minute drive. Nothing over like 45 miles an hour, so
Mhm.
it's pretty simple.
Hmm.
But I still, I don't know, constant worry. I'm like, my hands
yeah,
ripped on the
clenched
steering wheel too much.
That's really difficult because you need to drive to get everything.
Yeah,
everything
used
that
to
you
love
need.
going out, but
Yeah, not anymore. So do you do anything for yourself at home now that?
not really.
Not really. Do you have any other ideas yourself about bringing in like a date night at home?
Maybe it just feels like it's not. I don't want to know what to do. I don't know. It just feels kind of disconnected sometimes.
Okay.
I don't know if that's me or her, but
Do you ever talk about any of your feelings with her?
no. It's kind of like because I don't want to bring up anything and like have to like go back to couples therapy or something like that, or like have to deal with that.
Mm-hmm.
Just want to.
So back to the original couples therapy, you said you only went for a couple sessions,
Mhm.
but what originally brought you guys into couples therapy?
We just kind of arguing a little bit more. She was drinking a lot more. Didn't really take ownership of her behaviors,
Okay.
things like that. So I suggested
Mm-hmm.
we should go. So I knew somebody.
It was a good
It
suggestion.
was good.
Yeah.
And then we tried it out. Only went to like 4 sessions. It was like we went twice in a row, and then we had to take like a week off. And then we went again last time, but
So it sounds like it's not something you're interested in anymore?
I don't know. I kind of figure I need to fix me. Really.
Focus on you right now.
Yeah.
Mm-hmm.
I mean, she still drinks. She still does those kind of things. But what am I gonna do
Yeah.
if I'm like laying in bed in pain too much? You know, I can't even go anywhere, so I can't blame her.
Yeah. But also, you need to do things that make you happy, and it's hard when.
I don't even know what that is anymore.
Do you have anything you like to TV show that makes you feel good?
Things just I don't know. Things since then just doesn't. Things don't really feel the same.
Okay. Do you think that just trying to think of exactly how you're feeling to get a better understanding? Are you feeling sad? Are you feeling more anxious all the time? A combination?
I mean, I try not to like self-diagnose.
Mm-hmm. That can be
But
hard.
I would say it's more. Like I said, I don't want to like self-diagnose. But I feel I don't know.
You're an
I
expert.
don't. Yeah. But I know I can get into my own head with
Mhm.
that. So like I don't really have much motivation. Pretty much, I don't enjoy activities anymore. Really. My appetite hasn't been too great. But I don't know if that's because I'm not going to the gym anymore or just it's not too great anymore.
Mhm.
Sleep's kind of impaired sometimes. Nightmares
The
will wake up
nightmares,
or
yeah.
difficulty falling asleep. Feels like my mind can't turn off.
Mhm.
I don't know. I don't like going in the cars and everything. So
Right.
I don't know. Maybe anxiety would be the closest
Anxiety.
thing. Maybe not. I don't know.
That's your number one feeling right now?
Mainly like when I think about like driving,
Mhm.
getting in the cars, or worrying about like pain, things like that.
Is there anything when you're in the car specifically that triggers you, or is it just the car in general?
Mainly, I don't know if other people are gonna be stupid
Mhm.
and like do something again.
Right.
I don't know.
Okay. Do you feel comfortable explaining what happened during the accident?
Yeah, someone was just weaving through lanes. Stupid kids just weaving through lanes.
Teenager.
Clipped me, and then I hit the median in the middle.
Okay. That's really traumatizing.
It was a pretty bad accident. They thankfully the ambulance got there quick. They took me to the hospital. I was there for a few days, and I had to go to rehab.
Right.
After that for 6 months. Pretty consistent early on, but it's pretty tough.
How was your stay in the hospital? I know that can be lonely.
Yeah, it was. My wife came, our family came.
Are you close
And
with your family?
after,
Sorry.
we're fairly close. But after like 2 days,
Mhm.
it's like, what are they gonna do? You're just kind of like sitting around.
Yeah,
doing
just sitting
nothing.
around with you, and
Yeah.
you feel bad. You don't want to take up their time.
And you get that hospital smell. It's
Yeah,
just,
and the food.
Yeah.
It's not the best.
Not the best.
So you're pretty close with your family? Who is your family that you?
It's just me and my
referring
mom
to?
left.
Okay.
She's a little older though, so she came to visit. But and I have like cousins and aunts that like text me, but they
Mhm.
live states away.
Okay.
So
It sounds like you have a good support system with your mom.
yeah, she was a big help. I guess mentally, she'll check in on me every now and then.
That feels nice.
Yeah, but she's also like an hour away,
Okay.
so I don't
She
get
can't
to see her too often. I'm not gonna drive out there.
Yeah.
So
How's your relationship with your mom?
it's pretty good. Can't complain.
Nothing to complain about. That's really good. That's rare.
Yeah.
Family relationships, but yeah. So does your mom know what's going on with you right now?
And what?
I guess emotionally, relationship wise.
I'll text her sometimes, but I don't want to make her worry. She's a big worrier. So.
Okay, so you're more of like an internal.
Yeah,
All in
because
yourself.
I know my mom.
Mm-hmm.
She worries about everything. Ever since then, she hasn't stopped worrying about like me getting in another car accident, and she always like, oh, you always have to drive safe. She always told me that anyway. So
Mm-hmm.
it's like if I tell her something, she's gonna worry, and I'm gonna just feel like a burden more than I already do.
So do you feel like a burden for both your mom and your wife?
Mainly just my wife. I don't want to burden my mom.
Mm-hmm.
So I just hate being like, feeling like it's almost relying on me. Like I need to be like needed on,
Mm-hmm.
you know. I don't like that feeling like
Yeah.
doing things myself.
Well, it's good you came to counseling
Yeah.
to be able to talk and express your feelings. Is there anything else about the accident that you think affects your life? I know it affects your work, your relationships, your physical.
I mean, those mostly cover it all. So
Okay. Oh, we are over. Do you think that talking helped?
yeah, I mean, I know I'm always obviously I'm a big proponent of therapy.
Okay.
I finally figured I should get in the other
Mhm.
side of the chair
Mm-hmm.
and go from there. So
All right.
see how it works.
Well, if you would like to come back, that would be awesome. But
Yeah.
if not, you can talk to me about it. I can refer you to somebody else.
Mhm.
But other than that, I hope to see you again soon.
Yeah, I'll schedule.
Awesome.
Thanks.
Let me, I guess, stop this. Oh, we